Welcome to the Global Tourism Forum's Recovery and Beyond Summit. The resulting health and economic crisis prompted by COVID-19 called for rapid, large-scale, and unprecedented responses. To this end, the pandemic has shown yet again just how critical multilateral development banks are in moments of crisis. These institutions are uniquely structured to tackle challenges that cross national borders. Such challenges like climate change or global pandemics, by definition, demand cross-border solutions. Furthermore, these banks play a crucial role to help counteract the pro-cyclical nature of financial markets, as private banks tend to lend too much during boom times and then ration credit during economic downturns. In 2008, for example, when few financial institutions were lending during the global financial crisis, it was the multilateral development banks which significantly increased their lending. My name is Sumaira Isaacs, and I am today presenting to you a very interesting session on financial security in the post-COVID-19 recovery. How some of the world's leading developing banks are leading the way and are so essential for that important liquidity that the world needs to reinvest in some of these lost economies, with a particular focus on healthcare and in turn supporting the tourism infrastructure. Talking to us today are a number of banks. Let's get started. Today, I have a very special guest with me for our Recovery Summit taking place in Istanbul. My guest is Dr. Patrick Osewe. He is currently the Chief of the Asian Development Bank's Health Sector Group, providing leadership on all health sector group technical and operational matters. Patrick has been at the forefront of strengthening health systems against the threat of disease outbreaks through innovative multi-sector approaches for more than 25 years. Prior to this time at ADB, Patrick worked as the World Bank's global lead of health societies. He received his medical degree from the University of Nairobi and holds a Master's of Public Health from Harvard University. Welcome, Patrick.
Thank you very much, Sumaira.
So the last time you and I spoke, the world was still seeking out the ever-elusive vaccine for the COVID-19. Well, that search is now over, and not one, but two major companies have announced over 95% success, Pfizer and Moderna of the USA. How credible are these announcements, as some critics feel they have been rushed and not enough research done?
No, the past week has been really good news for COVID because we now have two vaccines, one from Pfizer and another one from Moderna that are 95% effective. This is when the vaccine, COVID vaccine research started, we did expect the vaccines to be this effective. And so 95% effectiveness is extremely good news. These are reputable companies, and they've gone through a very thorough process of developing this vaccine. So I don't think that people should be worried that the vaccines are not effective. And then, of course, they have to go through a whole process of submitting their dossier to the US Food and Drug Administration that expertly review the data just to confirm what the companies have talked about.
So share with us behind the scenes, what led to this groundbreaking invention in record time? Because I know in your position and in your role, you've been at the forefront of some of these activities taking place. So I'm really interested because I know that we spoke about it even during our town hall. And share with us, a little bit of sense. Give us a sense of the road to this vaccine.
So because of the impact of COVID vaccine on global economy, whereby almost all countries were affected and the economic activities were shut down, there is so much research on this on the vaccines than any other vaccine in history. In the past, the shortest period to go through the whole process and having a vaccine available was from 4 years to 17 years. This is the first time that we are getting a vaccine within 1 year. And because there's been so much research, the best and the brightest were involved in this, significant resources that were made available to discover a vaccine to be able for the world to go back to the old normal. And so this is why this has been very unique, because all the big companies were involved, many universities were involved, many biotech companies were involved. And so with a collective effort and significant resources, that's why a vaccine has been discovered in a very short period of time.
So what was the role of ADB amongst many others, and why this support was necessary?
So ADB as a development bank, just like any other development bank, our goal is to support countries for economic growth and to alleviate poverty. And so with COVID, with economies shut down and so on, this is a big concern for all of us, that instead of progressing and countries people becoming wealthier and getting out of poverty, COVID was actually plunging people further into poverty, because people were getting sick, people lost their jobs, and this was a big, basically undermining progress that countries have made over the last 60 years. So as an organization, in April we allocated $20 billion to support our developing member countries. First to implement, to support people that were out of jobs, but at the same time to build the testing capacity to enhance the health system, and so that people could get tested, people who are sick could have hospital facilities to go to. Those who needed ICU were able to have to get breathing support at various ICUs that were located within the city, and also in primary care facilities across the region. So this was really important. And what Asia has done, we are seeing significant progress in terms of the numbers of coronavirus, and also the mortality rate has gone down over time. And we think that collective effort from ministers of health, ministers of finance, international organizations, and the technical partners, we are able to work together to support countries to be able to prepare and to respond to COVID-19. And in terms of vaccines, we are in discussions right now of establishing a financing facility, the significant resources that a country will be able to have access to purchase vaccines and also to prepare for deployment within the country, because deploying a vaccine to millions of people, particularly adults, is not very easy, because the current vaccines are targeting mostly children, and the COVID vaccine will be targeting adults, and that's a completely new area for many countries. So we are providing resources for technical assistance to identify, for example, who should get the vaccine first, because the vaccine will not be enough for everybody on day one. There'll be fewer vaccines at the beginning, and then progressively increasing. And so with that, each country would have to go through a process of identifying who will get it first, who will get it second, who will get it third, and how do they progressively increase the number of people who are going to get it. This can be a political issue, and therefore each country would have to organize this and discuss and reach a consensus on this regard. The cold chain requirement, because vaccines have to go through a process whereby they are transported and also stored in low temperatures and so on. And once that has to be established and also to have that in place. And then once you already have the vaccines in the hospitals, the primary care clinics, the doctors' offices, and so on, then the question is the bulk of the vaccines, of the 11 leading candidate vaccines right now, about 9 of them require 2 dosages. And so that means that whoever gets the first vaccine has to come back to the clinic 21 days later or 28 days later to get the second dosage. Or if the elderly and we have to go, the health system has to go to them, they have to do that. So this is going to make it very complicated, because if you get only the first dose and you don't get the second dose, then the immune response is not as effective as if you get the 2 dosages. So having a system in place of ensuring that whoever gets the first dose gets the second dose is going to be very important. And as I've mentioned earlier, this was also new vaccines. Some of them are new technologies, and therefore it will be important to monitor how, if any of the people who are getting vaccines are getting any adverse events. And so having a system in place, and particularly an electronic system, that you're able to remind people to come for the second dose, for people to report if they're getting any adverse outcome is going to be very critical.
And how much is the difference, the gap between the first and the second dose?
So the gap for I will only talk about the two vaccines right now. And so this for Moderna is 21 days later, and for Pfizer is 28 days later. So you get the first one, and then you get the second one after 21 days or after 28 days.
That kind of dovetails into my second question, was what is the difference between the two vaccines? You know, so can you just expand on that a little bit more?
So the technology that Moderna and Pfizer have used is a new technology. It's a technology that has been tried for 30 years to try and come up with a vaccine, and it's not been successful until now. Basically, we call it messenger RNA. The technologies, you take a very small part of the genetic code that is injected into the cell, and then the cell responds by producing a protein, and the body then recognizes that protein and produces a protective antibody. So if someone is infected, the antibody then binds onto that the COVID virus to ensure that the person is not infected and so on. This has never been tried before, and therefore it's a very good technology, and that's why it's been even much faster to be able to produce a vaccine in 10 months. Now, of the two vaccines, the Pfizer vaccine requires ultra cold temperature for storage and for distribution, which is basically minus 75 degrees centigrade. That is very cold, and many countries are not able to maintain such temperature. And Pfizer, I've read that they are trying to work on that to ensure that over the next many months, they get a more stable temperature to be able to distribute the vaccine. Actually, they even said that perhaps distribute the vaccine at room temperature, but of course that remains to be seen. For the Moderna one, currently the temperature for storage and distribution is minus 20, which is the temperature in your freezer at home. And so although that is still cold in many places, particularly in some of the poor countries, but that is a little bit manageable compared to the Pfizer vaccine.
Okay. I think it's only a matter of time that also you will have a lot of generic developers then producing it in mass production. I think the world will need that, especially for the poor countries. So interesting, the fine differences that you are talking about. So can you?
Yeah, but just to add to that, these are only two vaccines. These are only two vaccines. There are another 9 in the pipeline and in the third stage of clinical trial. But all in all, there are almost more than 200 vaccines that are being tested from the beginning all the way up to the final stages. So there's an explosion of research to come up with all sorts of vaccines. And I foresee a situation whereby in a year's time, there'll be very, very many different types of vaccines that countries will have access to.
Excellent news. This is really good news. So can you talk about, okay, now we have the vaccine, okay, but the next thing is distribution. And some of the richer countries, you know, the more developed countries, that's not an issue. But, you know, between the wealthy and the poor nations, how will this distribution take place? And what is ADB doing to support the distribution?
So the obtaining a vaccine for rich countries and poor countries is a big issue. And just to give some historical perspectives, when HIV/AIDS started as a pandemic, the antiretroviral drugs were discovered, and the rich countries were able to have people living in rich countries were able to have access to those drugs because they're expensive. They're about $20,000 per year of treatment, and many low and middle income countries were not able to afford that. So it took almost more than 10 years for poor countries to have access to to treatment and so on. So for COVID-19, the good news is that a global facility called COVAX, comprising of the Gavi, the Vaccine Alliance, the World Health Organization, and the Coalition for Epidemic Preparedness and Innovation, has come together to create this facility, and they're doing fundraising. The target is $2 billion. They've raised about $700 million to support the research of various vaccines. So they have a portfolio of vaccines that they are financing, and the agreement with those companies is that when vaccine is discovered, it will be accessible to low-income countries, the poor countries, and so on. And at the same time, the big pharmaceuticals are also will be contributing vaccines to the COVAX facility. So we have a situation whereby for COVID-19, the low-income countries and middle-income countries will get vaccines, but of course, there will not be enough vaccine for everyone. Now, for rich countries, many rich countries, like say, for example, the United States, the European Union, the United Kingdom, Japan, Australia, they have done advanced purchase of these vaccines and so on. So they will get priority when the vaccines are produced by some of the companies and so on. So there'll be some mismatch whereby there'll be more vaccines for richer countries than poorer countries, but this time around, at least poorer countries will still have access to vaccines, and then progressively over time, with more vaccines coming to the market, poor countries will also have access to more vaccines.
Okay, that's interesting to hear about that. So in all of this, tell me, is this good news for tourism industry, travel and tourism, which has completely come to a standstill, and it really contributes to the livelihood of many, specifically in the regions that the Asian Development Bank is involved with. So why is it a good news for this industry?
So in our region, in many countries, tourism is a driver of economic growth. If we take a country like Maldives or many of the Pacific Island countries, or even Thailand, the tourism is a significant part of the economy. And we've done a lot of work in this area, looking at what has been the impact of COVID in the tourism industry. It boils down to confidence. People cannot go as tourists because of fear of getting infected either at the airport or in the plane or in the hotel, or when they go to their destination and then they get infected there, particularly if it's a country where the health system is also very weak. And so with vaccines being available and a tourist has received the vaccine, they feel protected. But at the same time, they know that if they sit next to someone in the plane, they are protected. If they go to a country where there are tourists, they are protected. But at the same time, that population is also protected. So once you start having that confidence, that's how we'll be able to open the economies. In our work, if you look at as in the discussions with IATA, for example, they say that before the vaccines, that the normal schedule would only come back perhaps in 2023, 2024. But now with vaccines, perhaps that can be accelerated, and we see a situation whereby if the majority of the population gets vaccinated in 2021 and 2022, that I will be able to go back to perhaps the old normal in a couple of years. So I think this is extremely good news. But I also just want to caution that it will take time for countries to have sufficient numbers of vaccines and to reach a level of immunity that is enough to protect everyone. And so before that, people still have to protect themselves. They still have to wear masks. They still have to social distance to be able to ensure that they do not get COVID. So it's good news, but it will take a while for the whole world to benefit from this good news.
Great, but how long do you think before the vaccine starts hitting the masses? Get first quarter, second, third, so that means
I think it depends.
in the meantime, people still need to take the precautions that they need to take, right?
Yes. So although the vaccines will be available starting from the first quarter of next year, a lot of things depends on what type of vaccine, because we just talked about the vaccines that require ultra cold temperature. If the bulk of the vaccines are such vaccines, then it's still not, because of the lack of refrigeration in many of our countries, that will still take a while. It also depends on how many vaccines are out there in the population in the countries, so that if various more vaccines come into the market and many more vaccines are produced, then perhaps towards the end of 2021 and early part of 2022, that's when many countries will be able to access vaccines. Of course, there's a cost as well. Some of the like the new technologies are more expensive than the traditional vaccines, so that's potentially a challenge. But that's where development banks come in, and also philanthropists come in to ensure that poor countries are also protected. So I think that you can't say mid-2022 everybody will be vaccinated. I think that would be far-fetched. A lot depends on what's going on in the manufacturing, and also the distribution of it, because the distribution sometimes is quite costly, particularly in some of the remote islands. In some of the countries, like say Philippines has 7,000 islands, Indonesia has 17,000 islands. To be able to ensure that everybody in all the islands get vaccine is not a simple task. So but there's a very strong leadership in some of our countries, and we see heads of states, ministers of finance being very much on top of it to acquire vaccine for their population.
Thank you so much, Patrick. This has been really insightful. And I think you and I will have many more discussions on this in the coming months. Thank you so much for your time.
Thank you. It is my pleasure to share my perspective on what I see regarding COVID vaccine. Thank you.
Thank you so much. Today, I've got a very interesting guest with me. Ms. Laurel Ostfield is currently the Director General Communications of Asian Infrastructure Investment Bank, AIIB. She is the official spokesperson for AIIB and responsible for all aspects of communications and brand strategy, including media relations and PR. The Asian Infrastructure Bank is a multilateral development bank with a mission to improve social and economic outcomes in Asia and around the world. Headquartered in Beijing, began operations in January 2016, as recent as 2016, and have now grown to 103 approved members worldwide. By investing in sustainable infrastructure and other productive sectors in Asia and beyond, the idea for the bank is to better connect people, services, and markets that over time will impact the lives of billions and build a better future. Welcome, Laurel.
Thank you so much for having me. It's nice to see you.
Thank you. So let's get started. What is the key role of AIIB in financial support? Because it's a relatively new bank, and perhaps people have not heard about it. So talk to us about that. And over the next 18 months, the Crisis Recovery Facility will offer up to USD 13 billion of financing to both public and private sector entities in any AIIB member facing or at risk of facing serious adverse impacts as a result of COVID-19. So would love to hear about that as well.
Absolutely. And so AIIB, you said, we're only 5 years old, so still very young, relatively speaking. But we are capitalized up to $100 billion US. And as you said, the focus for our investment is on infrastructure and other productive sectors. So other productive sectors mean any sector that's going to productively contribute to a government's economy. Our focus is primarily on infrastructure. And traditionally, we have done a lot of hard infrastructure. So bridges, roads, energy transmission, distribution. However, with the arrival of COVID-19 and the pandemic, we quickly realized that we needed to be responsive to the changing needs of our clients and our members. Because for obvious reasons, governments had to reprioritize what mattered most. So we created what we call the Crisis Recovery Facility, and you're correct, it's capitalized up to 13 billion US dollars. And this was really to provide fast and quick, nimble financing to our clients and to our members to help them manage through the pandemic. And so the money is going towards health infrastructure, pandemic preparedness. It's also going towards economic resilience, injecting some much needed liquidity and capital into the system, especially for those countries that are really struggling.
Okay, that's great to understand. So what does AIIB finance for health sector in particular means, especially now in COVID crisis, but also post-COVID crisis, because now there's been a vaccine, not one, but two vaccines and perhaps several others which are already on the market. And so how is the finance for this health sector in particular shaping out?
Yeah, and this was very much a new territory for AIIB. While we had always anticipated we would exit and enter into the health sector at a certain point, this happened much quicker than we thought because of COVID. But under the CRF, that facility that we were just talking about, we have been financing health infrastructure, pandemic preparedness, the purchase of medical equipment, and maybe I can best describe one of the investments that we did approve for the Maldives, which, as I'm sure you know, is heavily reliant on the tourism and the tourism sector. And they were really looking for support from us for protective equipment, community engagement, as well as disease surveillance and infection prevention and control. So you can imagine for a country like the Maldives that is really wanting to welcome tourists back into their economy, being able to manage tracking and tracing and prevention control was really going to be critical for them to bolster. And we were very happy to provide some financing to support that.
Okay. What about distribution? Because China has been really leading the charge, in the fight against COVID-19 and has been a little bit ahead when compared to the rest of the world. I'm sure that's been thought through much earlier than while the world is still catching up. Talk to us about distribution. Is there anything that the bank is doing to support that in particular?
So we actually did provide China as well some financing. It was the very first project that we did in the health sector, because China itself was also, this is going back to February, March of this year, looking for financial support in order to respond and manage the pandemic. Now, myself, I'm based in China, and I thank the response they've had here, because life is pretty much normal, fortunately, in Beijing, but I'm sure there's lots of lessons that can be learned. Now, from an AIIB's point of view, we really can provide support based on what the particular need is from that client or from that particular country. So if a client was looking for help on distribution or vaccine purchase, we can absolutely consider that under the Crisis Recovery Facility. We haven't yet received those requests, but it can be reviewed by our board.
Excellent. Talk to me, how does AIIB mitigate the negative economic impact on its members' economies because of the pandemic?
There's a few different ways, and we really put our package together to provide a suite of supports to countries that are looking for help. And so our financing is available for the public sector, but also for the private sector, because you really need to support both when it comes to getting the economies back on their feet. So we can provide capital and liquidity to governments themselves. So we have partnered with the other multilateral development banks to provide budget support and policy support, which is not normally where we would invest. But in these unique circumstances, we're working with our partners and collaborating together to provide that extra injection of financing. We're also working with the private sector in terms of on lending transfer some money to small and medium-sized enterprises. If you're thinking about it in terms of impact in the tourism industry, obviously many people aren't able to work because the international borders are locked down in most cases. So some of this money can actually go towards individuals to replace some lost salaries and livelihoods to help them through these difficult times. And we're actually considering projects just like that for Cook's Island and Fiji, who are both heavily reliant on tourism to drive their economies. And this is another project we're partnering with the Asian Development Bank on, and we're providing countercyclical lending to small and medium-sized enterprises, plus that financial relief to sustain the livelihoods of regular people.
Okay. That's very good to know. So when I was doing research on your bank, because I was very curious on your for activities, the bank is guided by thematic priorities, which has several projects. Talk to us about these and how COVID is shaping some of the strategies around them.
Absolutely. Just like everyone else, COVID threw a wrench into our plans as well. And we had to be quite nimble and agile in how we were going to move forward as a bank. And the timing was quite important because it was also at the time of us drafting our very first corporate strategy. So what our thematic priorities are really to help focus where AIIB is going to make its investments. The first one is green infrastructure. So this is everything around climate resilience, climate adaptation, clean water, clean energy. That is a really big part of the kinds of investments that we make. We also have investments in connectivity. So AIIB is very much invested in how can we better connect the region, not just within Asia, but also Asia with other regions like Europe or Latin America or MENA as an example, to improve and make those economies better interrelated, because we think this is really important in order to unlock the potential within Asia and around the world. So that could be cross-border connectivity, it could be regional cooperation initiatives, including like an electronic grid or electric grid. Those are just some examples. We've also added digital infrastructure as one of our priorities going forward. And this is about how can we integrate technology into the infrastructure that we are building. We don't want to build the infrastructure of 20 years ago. We want to build the infrastructure for tomorrow. And so technology can really enable the infrastructure that we have to be more efficient, operate better, but it also can teach us new and different ways of doing things. An example is we recently worked on a project in Indonesia to launch a satellite. Now that satellite is going to be able to connect the thousands of islands of Indonesia that otherwise weren't actually connected to the internet. So if you think about the impacts on education or healthcare, now that you can actually have online learning or telehealth, which wasn't not going to be there before, it really is a major impact. We're also looking at how can we unlock the private capital? So private capital mobilization, because the trillions of assets under management really are what we need if we're going to address the current infrastructure gap. And as we're looking forward, as I said, we want to invest in the infrastructure for tomorrow, and looking at the members in our region, obviously tourism is one that's a big economic driver throughout the region. So we are looking at other sectors beyond that. Healthcare is one first that we're going to be investing in as we just started this year, but we're absolutely open to looking at other sectors such as tourism.
Okay, that's good to know. Which kind of dovetails into my next question was around the tourism sector as a whole, that as you've already identified that as an organization that is investing in sustainable infrastructure that over time will impact the lives of billions, that tourism is an attractive sector. So when we are talking about tourism, because now I think now the reality that tourism and healthcare goes hand in hand. It's becoming very, very clear. So you already talked about that digital economy, your digital infrastructure. But other than that, do you think there is a future for building sustainable cities, or investing into smart cities, or investing into healthcare cities. Here in Dubai, we actually have these different various zones that the government has created, that and each of these they are almost like free zones, and they are into internet, media and PR cities. Then you have healthcare cities. So do you think there's an opportunity, especially in developing countries? Because I was looking at some of the markets that the bank's activities are. I'm talking about perhaps Bangladesh, Pakistan, South Asian countries there, to invest in these kind of cities.
Absolutely. So when I say that we're looking to invest in the infrastructure for tomorrow, it really is the infrastructure that is going to unlock the potential of the region. And in some cases, that is going to be unlocking the potential of the urban areas. And so if it's investing in clean water, if it's investing in smart cities, if it's investing in health technology, all of that is potential on the table for us here at AIIB. What we want to do is when we make those investments in the infrastructure, that we are thinking, how is this going to help this particular economy move forward? How are we going to grow wealth within that particular area? These are the questions that we ask ourselves. We're also very focused on creating climate resilient infrastructure. So infrastructure that is not going to have a detrimental impact on the environment. It's all about sustainability. So absolutely, depending on the development path for each of our members, we want to be their partner and on that journey moving forward to a digitally enabled, low carbon future that really brings prosperity and growth to Asia.
Thank you so much, Laurel. This is really quite eye-opening, because as a new bank, I think liquidity is so important today for the businesses to going forward. Yes, there's the vaccines are there, but the impact, the loss that already has hit the markets, to recover from that, to have another institution which is able and there to support, especially in healthcare and infrastructure, this is very, very, very hard thing. Thank you for being on our session, and we perhaps will do another one with you in a little bit more detail, because I think we need to hear more.
Absolutely. Thank you so much for having me. And we actually will be in the UAE in October next year for our annual meeting. So I look forward to myself seeing the sectors in Dubai that you mentioned, because we think that there's great opportunity for us to work in the UAE, but as well all over the region. We feel privileged to have been able to support clients through this very difficult time, through this pandemic. We look forward to continuing to work with everyone to help everyone through this difficult time. But thank you so much.
Thank you.